Hi, if you suffer from gallbladder issues and you want to understand your problem, this is for you. I am Dr. Rajeev Pullagura, Consultant General and Laparoscopic Surgeon in Bangalore. What is the gallbladder? Your gallbladder is a small, pear-shaped organ that stores and releases bile. Bile is a fluid your liver produces that helps in digestion of the fat in the food you eat. Where is the gallbladder located? The gallbladder is located on the right side of your abdomen, just below the liver. What are the functions of the gallbladder? Your gallbladder is a part of your digestive system. Its main function is to store bile during the fasting state. Bile helps your digestive system break down the fat. Bile is a mixture of cholesterol, bilirubin, and bile salt. Your gallbladder is connected to other parts of your digestive system through a series of bile ducts called as a biliary tract. The biliary tract is like a pipeline system that carries the bile from the liver to the small intestine. So, what does the gallbladder do? Before you start eating, your gallbladder is full of bile. When you start eating, your gallbladder receives a signal to contract, squeeze the stored bile through the biliary tract. Bile passes through the common bile duct into the duodenum, that is the first part of your intestine, where it mixes with the food waiting to be digested. What are the common issues that affect the gallbladder? Gallstones are pebble-like small objects of biliary material developed in the gallbladder or the bile duct. They can be as tiny as a grain of sand or as large as a golf ball. Cholecystitis is nothing but inflammation of your gallbladder. Gallstones pancreatitis is another concern. Gallbladder cancer is the rarest of the condition. What are the symptoms of gallbladder problem? Some people do not feel gallstones or they don't even know they have gallstones. That is something called as asymptomatic gallstone. But if your gallstones block the flow of bile, they can affect your gallbladder or pancreas. You may experience the following symptoms: right upper abdomen pain, upper mid-abdomen pain, upper right abdominal pain radiating to your right shoulder, and your back pain after consuming a heavy fatty meal, jaundice that causes yellowing of your skin and white of your eyes, nausea and vomiting could be an accompanying factor, and sometimes fever and chills also may be present. How are gallbladder issues treated? Most gallbladder issues are treated with removal of your gallbladder. Surgery to remove your gallbladder is called as cholecystectomy. Your gallbladder is not an essential organ. That means that you can live a normal life without a gallbladder. When the surgeon removes your gallbladder, the bile flow out from your bile duct directly into your digestive system instead of being stored in the gallbladder first. Surgeons can perform gallbladder surgeries or cholecystectomy in three ways. The traditional open cholecystectomy. With the open surgery, your surgeon operates through a large incision on the right side of your abdomen and your gallbladder is taken off. Laparoscopic surgery generally leads to a faster recovery, less pain, and a smaller scar. In most cases, cholecystectomy will be performed laparoscopically. Robotic cholecystectomy, this is a more recent and advanced scenario. It's performed in a very few centers and quite expensive. Before surgery, what can be expected? Basic blood workup to check your fitness for surgery. Complete blood count, sugar, kidney function test, liver function test, a chest x-ray, and an ECG. Other tests may be advised based on your health status like a cardiac checkup or coagulation profile. Please provide adequate medical history even though you may feel it is not very important to your surgeon and his team. If your bilirubin is elevated, you may be advised to undergo something called as an MRCP scan to find out any blocked stones in the biliary tract. Coming to the surgery, what can you expect? Overnight fasting before surgery or at least 6 to 8 hours of fast before surgery is a must. Nowadays, most gallbladder surgery is done by laparoscopic surgery or a keyhole surgery or a minimal invasive surgery. Consent for your surgery, you will be explained by the surgeon or his team regarding the surgery, the complications and the outcomes. Please clarify any doubts or concerns you have during this process. Patient is generally operated under general anesthesia. You will be housed in the operating room or the theater for about 3 to 4 hours. Average duration of surgery is about 45 to 90 minutes. Surgery involves either 3 or 4 small holes that are made on your tummy, approximately half a centimeter to 1 centimeter inside. Laparoscopic surgery involves inflating your abdomen with a safe gas and then performing the surgery while watching the television. Gallbladder is connected to the liver and the biliary apparatus via something called as a cystic duct. Your surgeon will disconnect the gallbladder in this region. The cystic duct is cut and clipped, and then remove your gallbladder in a safe manner. Most patients will be allowed to take oral liquid 6 hours after surgery. After surgery, you will be given some IV fluids, antibiotics and pain medication. You can start getting out of bed after about 6 to 8 hours after surgery, after the clearance from your doctor or his team. You can be discharged 24 to 36 hours after surgery, provided all your parameters are normal. You will be discharged with some tablets, antibiotics, painkillers and antacid. After surgery, you are advised to take adequate rest with a spaced out small meals for a couple of days. Avoid spicy and oily food during this recovery phase. Dinner should ideally be taken 2 to 3 hours before you go to bed. After surgery, you may require to meet your surgeon for at least 2 to 3 times. Suture or the stitch removal is around the 10th day based on the type of suture used by your surgeon. Sometimes it may not be required to remove the suture also. 4-wheeler travel is permitted according to comfort. Avoid 2-wheeler travel for about 3 weeks. Now, what are the danger signs or red signs you need to keep in mind? Persistent fever after surgery, sudden increase in tummy ache, excessive bloating, breathing difficulty. Connect to your doctor or your hospital for immediate assessment. How will my diet change after gallbladder surgery? Your gallbladder is not an essential organ, but it will help you in digesting your food. Immediately after gallbladder removal, you will want to avoid fried and greasy food to help your digestion improve. After surgery, fat calories should make up not more than 30% of your diet. Take time in reintroducing high fiber food such as whole grains, nuts, seeds and vegetables. This may cause severe bloating and gas if you eat them too quickly. If you found this information useful, please like and subscribe for more informative videos.